dogs. It's bringing the package with you when you come to see us, and so we can call poison control. There's also poison control that you can call as well, and we can know, based on what they ingested, what we need to do.
Actually, on our website, there is the poison control number for people, the pet owners to call. And I know that, Glenn, you were saying you guys have a rescue, pet first aid?
Yeah, we've got a pet first aid that we actually have to take in the search and rescue group so that we can help out the dogs if they get injured on a search. We've got a number of dogs that actually do searching for missing people, searching for human remains. And we worry about them, cutting a paw, getting injured. We actually did a training last year with VMAT, which is a veterinary group that goes out to disaster areas and can help out various different animals. And the training that we were doing was working with dogs on big rock and rubble piles. And you get cuts on the paws, you'll get cuts and injuries and bruises and that type of trauma that will happen with the dogs, because these are motivated dogs working on a rock pile.
Yeah.
And how do you deal with them? How do you help them out? How do you get them back? Most of what we carry is like a spare leash in case somebody on the team has to maintain the dog, and the leash failed, a muzzle if it's needed for the dog, because sometimes any dog will get a little scared.
Right, exactly.
And 4x4s, the regular 4x4s that you could buy at a first aid
the gauze sponges, yeah.
I was going to say 4x4. Piece of lumber? What are you going to use a 4x4? Okay, you're talking, all right, okay,
gauze.
the little gauze bandages. Okay,
or just
got
a big pile of paper towels, whatever you can get.
Yeah.
Try not to use tape, use a vet wrap. That's a great stuff. It doesn't stick to their fur.
Now, where do you get all this stuff? I mean, where do you get stuff for first aid? I mean, I want to know how to build a first aid kit. Where would I go? Who would I?
Some of it can be at the pet store. That's where you can get the vet wrap. It's like stretchy colored material that you can tear and it sticks to itself.
Okay.
But then things like gauze and the bandage wrap material you can get at your local pharmacy. Anything. It's the same. We use the same stuff as humans.
All right. So tell me a little bit about what you would do. You were talking about things that you could do yourself. So like checking the gums. And
yeah, like one of the most important things is checking the gum color. So with Rigley here, you want to lift up their gums and you can see right above their teeth, and it's supposed to look very nice and pink. You can see how nice
hold that just for a second. Look how pink his gums are. Okay, and Wrigley says, hi matey.
And the colors you don't want to see are a pale or very white mucous membrane. Blue can mean lack of oxygen. Or you can see a muddy color or anything like that. So you want to see nice and pink. And certainly you want your dog to be comfortable with you opening its mouth, because sometimes some dogs chew on bones that they're not supposed to, and they can get stuck. And so having your dog be okay with you looking in their mouth and
so you should do that. I've been doing that so that they get used to people looking in their mouth. So I do that with my
ears,
dog.
because a lot of times dogs will have ear infections, so it's difficult to look at a dog's ears when they hate their ears being touched. So doing things like that, you can take your dog's temperature. It's very easy. Just have a digital thermometer like you get at any drugstore. I love the speed read thermometers, which takes like 10 seconds.
10 seconds.
Oh yeah, they're wonderful.
That's excellent.
Yeah, and unfortunately you have to take it up the butt.
And folks, we're not demonstrating
We're not going to demonstrate
that. You just go to your vet and ask them to show you how to do it.
Yeah, and essentially you just use Vaseline or KY jelly and you stick it up their butt.
You insert it gently up their butt.
Yes, my word.
And I will say, I will say that I know I had to do it because my doggie was extremely ill. I almost lost her. To this day, they don't know what happened. They think it was an autoimmune disease, and I had to take her temperature. And I know I had to gently insert
you do want
it,
to be gentle.
and it was only like maybe an inch, not very far.
Yeah, not very far, because remember, what's taking the temperature is actually the tip of the thermometer.
I mean, exactly.
Yeah, so you don't have to
just insert it gently,
just a little bit, just a little bit. Yeah.
Alrighty.
But the other thing that you can watch that's important is the respiratory rate or the breathing pattern. So first you want to look at the pattern. Now Wrigley's panting. This is a normal pant. His chest is moving in and out at a slow slow rate.
He's bored.
But he's not using any effort. You know, when you see a change in effort, and remember, anything that's wrong is a change from the normal. So you want to know what normal is for your dog or cat. Watch them breathe and know what's normal, because it's when that changes that it becomes abnormal. And usually you'll see an increase in the abdominal component. So instead of their chest expanding, you'll see a lot of expansion in the abdomen. So you want to know that. And then you can take their respiratory rate. And that's really counting how many breaths you see over a 15-second time period and multiply that by 4.
Okay.
And so normal at rest, I mean, there's 2 different respiratory rates. There's the respiratory rate when they're coming in from outside, and there's the respiratory rate when they're asleep on the couch.
Okay.
And, you know, you want to know what the resting respiratory rate is. And if they're asleep on the couch and they're anywhere from, you know, 10 to 25 or, you know, 36 breaths per minute, that's pretty normal. When you get up to 50 or something like that, that's abnormal. And remember, it's a change. It's what's not normal for that dog. So that's important. And knowing too, actually, where their heart is. So a dog and cat's heart is under their armpits. And so being able to put your arm under the armpit and feel, most dogs, especially if they're not really overweight, most dogs, you can feel the heart beating, and you just want to make sure it's not like really, really fast.
Okay.
You know, it's hard to sometimes take an accurate heart rate that way, but you just want to make sure it's not, you know, very, very pounding and really fast.
Well, I think that's the information that you've given is extremely valuable. I think everybody should check, maybe give them a call, go down and visit with Dogs and Cats Veterinary Referral. And get to talk to them, see what's going on. And before we go, I know we're getting short on time, there is a little video clip, and I think my support staff back there, he's getting ready to put it up, and it's called, and I'm hoping this will work, because Timmy's going to come back next month. So if this doesn't work, we're going to come back next month with this. And it's called, So You Think You're Cute. Okay. Can I comment? So the audience, you're listening to me? All righty then. That's what I like. That
they do make dog seatbelts.
I know they do.
They're very important.
I know. And look at this. Great Dane and a little kitty.
So cute.
So kitties and dogs can take.
My dog has done that exact thing.
And hopefully, we're going to see the whole thing. And this is cute. I love this. The glasses. And yeah, I'm going to be out here on a cold winter night. And I love this.
That's great. That's great.
So you got tongue. Where's the beef? No, let's see. This is a parfait. Okay. And folks, as we're winding down on this, I would like to invite everybody to visit our website, www.buoyclaw.org. And listen, if you had a hard day, suck it up, Cupcake. It's time for Cause for Paws for Claw. Thanks, everybody, for joining us. www.buoyclaw.org. See you next time. Thank you.